The good news is you can do this. And I'm going to encourage you, whatever you've been through, my prayers are with you. My thoughts are with you.
Hi, welcome to Balancing Your Life with Dr. Rolla. Today I want to talk to you about what happens at the Youth Suicide Risk Assessment. Oftentimes, as a parent, a family member, when you take your child to be evaluated by a primary care doctor, psychologist, psychiatrist, you will be at some point asked to maybe leave the room so that there will be an interview. For me, as a psychologist, it is important for me to gather information from family, and I tend to get the presenting information at the beginning of an interview, which is what brought you here. Maybe the child had a note at school that the teacher found out, or there's some unusual behaviors like isolation, talking about giving up on life that the parent is concerned about, that led them to bring the child for the evaluation. So I'm going to get that. But when I'm interviewing the young person, the parent is not going to be there because I'm really trying to get a lot of information that they may be concerned about sharing if their family member was there. And so I wanted to give you some insight into what happens at these assessments to really encourage you that this is a good thing to do if you're ever concerned about a young person's depression or level of suicidality or level of dangerousness. It is critical that we get the person checked out. The same way you would take your young person, your child, to a doctor. If he or she has a cold, has a cough, and the over-the-counter medication is not working, I want us to have that same approach to mental illness. If we're not sure, why not get it checked out? What is the worst that can happen? It can't be a bad thing. Even if the person makes a determination that the young person is doing well, at least you have that information, and that is encouraging for you and for the young person who is being interviewed or who there's concern about. So this is why I wanted to open up a little bit to you as to what we do at a youth suicide risk assessment. Now, every clinician, of course, has a different style of interviewing. So what I'm going to share with you today will not necessarily be in the same order like another clinician will do it. But I'm going to share with you basically what any good, solid suicide risk assessment would involve. A little bit about my background. I've been doing this as a psychologist for over 21 years. And one of the first things I actually started doing on a very consistent basis in my mental health experience is suicide risk assessment. I worked in a psych hospital for young people and adults, and people came off the street, whether they had insurance or not, to be evaluated for us to make a determination as to whether they meet criteria for admission to our hospital or maybe for intensive outpatient treatment in the community or just general outpatient treatment. So I've been doing this for a very, very long time. And even though I've been doing it for a very long time, I always approach every youth suicide risk assessment with a lot of sensitivity and with a lot of curiosity. I will never, for the rest of my professional career, ever approach a youth suicide risk assessment with this overconfidence, like I know what I'm doing. No, I enter it with a sense of curiosity and openness to gain information from the person I'm interviewing so that I can make the best determination for their best interest, and I can form a diagnostic impression that is correct. So I'm never overconfident. I'm going in to observe, I'm going in to gather information, I'm making notes, and I'm checking in with the person I'm interviewing to make sure that I'm getting a good idea as to what is going on. Now let's go into what I will be asking about in the youth suicide risk assessment. I like to make the person feel comfortable, especially a young person. It is pretty scary to come into a hospital and meet somebody you have never met before. It makes you feel like maybe you are being punished or something bad could be happening. So I try to come in with a very calm attitude. I actually come in with a calm attitude. I introduce myself. I tell them my job title. and I say something like, I want to get to know a little bit more about how things are going on with you. I ask the young person to tell me their name, their date of birth, their school, what grade they are, what university or college they're attending. I'm trying to break the ice here. I don't want to delve directly into suicide because they may not tell me as much. I want to make them feel comfortable. I'm trying to build rapport here. I want them to see me as an ally. I'm trying to provide reassurance. Then I ask about school. I like to ask about issues that are more benign. Tell me more about your school situation. That question, as you can see, is open-ended. Do you have friends? How do you get along with them? Do you have people do you have problems in school? Is there any bullying? Do you get into fights? Do you feel safe at school? How do you get along with your teachers? Since school functioning is a critical area of a person's life, especially a young person, and they spend a substantial amount of time at school, what is going on at school has a lot to do with that person's functioning. What subjects do you like? What do you like about school? What don't you like about school? All that is helping me to understand the person's functioning in a critical area of their lives. Then I talk about their family. Tell me about your family. Their living situation. Who lives in the home? Who is the parent or the guardian in the home? What is their relationship like with the guardian? What is their relationship like with the siblings? Do they get along? If things are hard for them or they feel overwhelmed from something happening at school, at home, is there somebody in the family they can talk to? I'm trying to understand some of the protective factors that this young person has. Is family a safe place? Is home a safe place for this person? I will also ask about family history of substance abuse, family history of risky behaviors. Is somebody ill in the home? What are stresses are the family facing? Somebody unemployed? And I'm not always asking this directly, but this information comes out through follow-up questions. Again, I'm trying to find out, is home a really stressful place, or is home a safe place? And do they have a good connection with family members? I've gotten the school information, I've gotten the family information. And now I want to talk to the young person as to what brought them to see me today. But as I talk about that, I'm going to talk about the history of depression and suicidality and history of mental illness. I'm going to talk about what is going on now. So if the young person had written a note at school saying that they don't want to be here anymore, I can ask, can you tell me a little bit more about that? I want to know if the issues that surrounding that time when they wrote the note, or when they started showing signs that are of concern to their family members or to the teachers, whether the issues are more short-term or were triggered by a threat or something, or they're much more long-term. When I get some understanding as to circumstances surrounding this presenting issue, then I'm going to ask them specifically, do you have thoughts of killing yourself? How often are you having these thoughts? Have you ever attempted to kill yourself? Are these thoughts intense? Do you feel like you can distract yourself from them? Do you feel the urge to follow through with your thoughts? Are you hearing voices telling you to kill yourself? I am direct about suicide. I'm not dancing around the issue at all, because I want to reduce the shame surrounding talking about their depression and their suicidality. That is important for me. I want to know if they have a plan to hurt themselves. Have they thought about what they could do if they wanted to do it? Knives, hanging. I would even ask for specifics if I feel like I'm not getting enough. I would also ask if they have harmed themselves before, because we do know that over 90% of youth who have had suicide attempts have never told that to a family member. I'm probably looking into information that they may have not shared with anyone else. All this is helping me to understand how severe the depression and the suicidality is. I want to know if they have means to something that is a fatal means of ending their lives, like a gun. And do they know where it is? Is it in a lockbox? All that is critical. I also want to know if they feel like they're a burden to people. Like, if I'm not here, my family will be better without me. If that is their perception, that is highly problematic. Do they have a sense of connection with others? Do they feel alone in the world, or do they feel that people really care about them? Another area I also want to find out is, what are their plans for the future? Do they want to go to Florida for summer? Do they want to spend time with their friends in the next few weeks? Do they want to go to college? Are they looking forward to studying the arts or the sciences? Or are they learning to play an instrument and they're looking forward to a recital? Is their outlook on life futuristic, or is it shortened? If it's shortened, I don't have any plans for the future, I don't really care, then I'm deeply concerned. All this time when I'm gathering information, I'm doing a mental status exam. I'm looking at their mood. Are they tearing up? I'm looking at their affect. Is their affect blunted or flat, or is it happy? I'm looking at their energy level. Do they look tired? I'm looking at their speech. Is it fluent? Is it spontaneous, or is it monotone? I'm looking at all these aspects. I'm asking about their sleep. Are they able to sleep at night? What is their eating pattern like? All this is helping me to come to a determination as to what the level of depression is and their risk of suicidality. And at the end of this, I am going to determine if the person is at a high risk of suicidality, a medium risk, or a low risk. If the person has a plan, they have persistent thoughts of suicide, they've attempted suicide in the past, they've engaged in self-injurious behaviors like cutting, self-harming, I'm going to be admitting them into the hospital. If the person had attempted suicide prior to them coming to the clinic, I'm going to be admitting them to the hospital and explaining to them why. Not as a punishment, to stabilize, to review their medication if they've been on meds. If they're not, try to place them on meds, do some group therapy, do some one-on-one therapy, and help them to see and find other ways to cope with what they're going through other than suicide. Medium level, if they have suicidal thoughts and they have a plan, they have suicidal thoughts, they're persistent, but they don't have a plan, they're in a safe environment. I might decide, depending on the family history they're giving me, all the school issues, and just the mental status I do, to admit them as well or not. If I don't admit somebody who's medium risk, I'm going to referring them to an intensive outpatient clinic. I'm making an appointment within the next 1 to 2 days, telling them where to go and giving clear directions to family and everyone around them to make sure that they don't have access to any means of hurting themselves and they're around family most of the time. If it's low risk, they may have fleeting thoughts of suicide, no plan, but again, I'm still referring them for outpatient treatment and recommending that we work on coping skills and helping them to cope with the stresses they're facing. One critical thing I want you to keep in mind: the fact that I am making a determination at this moment that this person is medium risk does not mean that they will not be high risk in the next 24 hours. I am making that determination based on what is being presented to me and based on the evaluation that I'm doing. So be careful as a family member and a guardian and saying, oh, he went to the hospital, they say he's fine. No. Even if I tell you that a person is medium risk or low risk, something could happen in the next 24 hours that could trigger a strong desire to self-harm. A relationship breakup, a divorce of parents, something, a bullying, some scandal on social media, anything could trigger it, and the suicide risk level could go up dramatically. So I'm basing it on the information that I have. That is why it is important that if you have concerns, don't feel bad that you come the first time. Bring the person back and take all the precautions necessary. So I hope this helps. I really think it does, because it gives you some insight into what is going on and to make you feel good about taking a young person in to be assessed. I want you to like this video. Tell me your experiences when you've taken a young person to be assessed, what your experience has been. Ask me any questions you may have about assessing a young person. Share this with as many people as possible and subscribe. And thank you so much for listening, and I will definitely talk to you soon.